All right, welcome back. The Ray Lucia Show, bringing you the best in money information. If you'd like to shoot me an email, I'd love to respond to you personally, as I do, at 5 a.m. just about every morning. RayLucia.com. I'll get to some of those emails momentarily. RayLucia.com. In studio with me, Lyn Rowe, certified financial planner, talking about post-retirement health care costs, in particular long-term health care. Thank you, Lyn, for joining me.
Thank you, Ray.
I got an email that I'm going to cover in a bit from, I think his name is Mark, from somewhere in Texas. Yeah, Mark, who starts with, great show, love listening to it. I recently purchased LTC thanks to your show and Lyn Rowe. So I want to thank you for that, LTC, long-term care insurance. Now listen, I want to get down to the nitty-gritty here, because I know you don't like just giving out quotes like, you know, an auto repair shop. Can you tell me how much? By the way, I got in a wreck the other day because I was I texted you this on the way in. I was multitasking, and I hit a guy going like a half a mile an hour, but his trailer hitch was sticking out, and my fiberglass bumper just was destroyed, like $8,000 worth of damage, hitting somebody, you know, a half a mile an hour. It was crazy.
It is. It's insane.
I should not have been multitasking on my phone. But anyway,
ride with you.
But I don't have whiplash, and that guy didn't have whiplash. He looked at it and said, "You're screwed, buddy," and he just drove off. I'm sitting there with the grill sitting in the road. People are honking at me. It's just terrible. Anyway, I hadn't been in one of those bumper things in a long time, so I guess it was overdue. And now I've learned my lesson. I'm surprised I didn't get a ticket. In either event, talk about what you wanted to talk about, because this quote thing,
yes,
I know drives you crazy.
It does. I mean, sometimes I hear people say, well, I got a quote from so-and-so, or I got a quote, or whatever. And there's so much more to it than just getting a quote, right? When I first schedule an appointment, the first thing I do is when I confirm the appointment, I send out the copy of the National Association of Insurance Commissioners Shopper's Guide, which is a really good primer for that meeting. So by the time they come to the meeting, by the time we actually sit down and talk, they have some knowledge of things they might want or want to ask about.
So it's all about educating them,
yes,
first. And
yes.
What is this thing you send out now?
It's the National Association of Insurance Commissioners Shopper's Guide, which, by the way, kind of ties in with the fact that it is National Long-Term Care Awareness Month.
Yes, I was aware of that because you made me aware of the National Awareness Month.
Yes.
Okay, so you send out a guide that's a generic guide. It's not got hype in it or any of that stuff, right?
No. And that's a primer, because then from there, when we have the meeting, we talk about what it means to self-insure. We look at the pros and cons. We look at the past self-insuring and what that's done. 70% of our folks in skilled nursing are on welfare. That tells you something. We look at the present, the costs of care in their area, and then we look at the future, because since 1974, skilled nursing has gone up on average a little over 4% a year, so that's pretty scary. And then we take a look at the big picture. Okay, now that we know what it costs, what resources do they have? Do they have income that can cover it, or would that create a hardship on the spouse? So once we have kind of a good handle on what we need the policy to do, then we go shopping. And we do a side-by-side comparison with the major carriers in their area.
So in other words, you're not, beholden to one company or another
No.
company. You're just basically giving them the options to do that. And I suspect that, like in my particular case, I did decide to self-insure at least a percentage of the benefit, because
right.
I figured, what the heck, I can handle $20 or $30 or even $50 a day. What I can't handle is $550 a day.
Well, and that's where the education comes in too, because we talk about that portion that you're self-insuring, and then we project that ahead. 20 years from now, what's that going to look like?
Right.
What's that going to look like in terms of cash flow or in terms of capital? So there's a lot more to it than just, like you say, getting the numbers on a current quote, because there's nothing worse than finding out that your fire insurance was inadequate after the house burned down.
Yeah, now we have learned that the average stay is about 892 days for the average person. The problem that I have with that statistic is I don't consider myself to be average. I don't consider you to be average. No one does. And so, I mean, an Alzheimer's patient could have a 12-year stay. I knew of somebody that had a 12-year stay in a nursing home just because of Alzheimer's.
Right, and I know a gentleman who cared for his wife off and on for 10 years, and it was not Alzheimer's. It was a completely different condition. So, and he pretty much got worn out because he was doing a full-time job and doing that. So it's very hard work.
Now, a lot of people say, well, you know what, I'll just take the Medicaid or the government program. And that's a risky proposition because, as I understand it, you have to spend all of your assets down to like $2,000. Is that right?
$2,000. That's exactly right. And the other thing is that when you do that, a lot of people are. I had one gentleman ask me the other day, well, I understand I can transfer the assets as long as I do it 5 years prior. What person in their right mind is going to transfer their assets to their kids 5 years ahead of time because they don't know they're going to be disabled in 5 years? I mean, that's crazy.
Well, there's also a moral, I think,
Yes.
decision that one has to make because do I want to have assets today and transfer them to my kids so that you can pay for my long-term care benefits later on? There's just something inherently wrong with that.
Yeah. Yeah. And even when you're starting to talk about transferring assets between husband and wife, you've got the 5-year look back, but nonetheless, what's to say that she or he isn't going to be the first one to become disabled?
Yeah, that's a very good point because I think the surviving spouse can have like $133,000 in assets. So I go ahead and transfer all of my assets to my wife. She either divorces me or she goes in the nursing home first. Either way, I lose. And on that subject, women have a much higher, I don't know about much higher, but a higher morbidity rate than men do. So
That's
this is even more critical if you're a female.
That's right, 75%. I mean, I tell the story when I'm talking to a couple. You know, if your best friend and my best friend were standing in the room, I say this to the wife, one of us might not need long-term care in our lifetimes, and I really want to think it's going to be me.
It's very important. Lyn Rowe, let's give out your phone number real quick because she answers questions from people all across the country, and it's no cost, no obligation. And look, she's so tiny she couldn't twist anybody's arm to buy anything.
It's 877-270-3127.
877-270-3127. Don't get your quote, okay? Don't be getting just a quote because then that would presume that you know what's behind that quote. It's sort of like, you know, shopping for a doctor. I had a conversation with a plastic surgeon not too long ago. And, you know, plastic surgery that's pretty important. You've seen some of these botched facelifts and all that stuff.
Frightening.
So do you really want to go to the cheapest plastic surgeon? Do you want to buy the cheapest policy out there, or do you want one that's actually going to address all of your needs?
Exactly. And I can't tell you how many times I've heard adult children say, I don't know why mom or dad bought that policy because it barely does anything. Well, at the time, they were trying to keep their costs down, and they thought it would cover everything they would need, and they'd be able to self-insure for the difference. Well, there you go.
My feeling is this. I would rather pay a little bit more or go with quality and less of a benefit so that I don't have to fight with an insurance company, or I know I've got a certain level of coverage and care than to have something that's totally inferior.
Well, and you bring up a good point. It gives you the ability to have quality care, especially at home. Especially at home.
All right, Lyn Rowe, iwantmyltc.com. Go to her website. Toss her an email. She won't give you a quote, but she'll send you some great information and help you through one of the most critical decisions you will most likely ever make. Thanks for tuning in. We'll be back with more of The Ray Lucia Show, and I thank Lyn Rowe. You take care. I'll see you next week.
Thank you, Ray.
All right, 877-PLANNER, the number. Want to chat about your money, your business, your life. I ain't going nowhere, but I'll be right back, so don't go away.
The Ray Lucia Show.